Please play the code of conduct.
Ladies and gentlemen,
I want to thank our department heads for being here, Dr. Ferrer, also Ms. Contreras, Dr. Contreras, and also Lisa Garrett. Thank you for being here. I wanted just to begin by making my statement, then allowing for my co-author, and then after the board has made their statements, I want to then begin my questioning of the panel to get their expertise and advice. So if I can begin with that, Madam Chair. Thank you again for recognizing me, and I want to thank Supervisor Horvath for co-authoring this motion with me. Colleagues, as you know, LA County is home to over 4.7 million Latinos, making them the largest ethnic group. I don't even know if that's appropriate to say anymore. Ethnic group in the region. Latinos, as you know, are the backbone of the county's economy, culture, and community. When most people think of Los Angeles County, they think of the many contributions that Latinos have made in this region. Latinos have had a profound impact on the county's culture, influencing the county's music, the art scene, food, and entrepreneurial spirit. Latino businesses in the county contribute a GDP larger than the GDP of many states, including the states of Louisiana and Oregon. Despite all their contributions that they have made to the County of Los Angeles, Latino residents continue to face disparities in several key areas, preventing the community from achieving its fullest potential. That's why this motion is before us today. For example, Latino students experience lower high school graduation rates and college enrollment compared to their peers in other racial and ethnic groups. In the Los Angeles Unified School District, Latino students are falling significantly behind, while their white counterparts in academic performance seem to be doing much better. Only 35.33% of Latino students meet English proficiency standards, compared to 65.4% for white students. And in math, 29.29% of Latino students are proficient, compared to 54.97% of white students. Latinos have continuously faced chronic health care inequities, including access to routine and preventive care, mental health services, and wellness resources. We saw how disproportionate access to care led to disparate outcomes for the Latino community during the COVID pandemic, where the death rates for Latinos was almost more than 1.5 times higher than the white population. And many Latinos also lacked access to good paying jobs. According to a 2019 report by the United States Census Bureau, over 761,000 Latinos in the county were living below the poverty level, almost 1 million. Latino households are increasingly becoming rent burdened, as many of us know. And in 2024, analysis by the UCLA Latino Policy and Politics found that about 55% of Latino renters in LA County face substantial housing cost burdens. And further, 53% of Latino adults in the county have low literacy levels, which affects not only their ability to access and understand our county services, but also their ability to navigate their communities safely. Latino communities in the county have the least amount of accessible park space. According to our own LA County Department of Parks and Recreation's 2016 countywide needs assessment, all our major metro areas, the LA region, has the least amount of accessible park space, and the problem is worse for predominantly Latino communities. The recognized standard for park access is 4 acres of parks for every 1,000 people. However, in Los Angeles County, Latino communities just have 0.6 acres for every 1,000 residents. This denies Latinos the environmental and mental health benefits that green spaces provide. Again, this is why the motion before us is so important for us today. Among many other things, this motion commissions a study on the status of Latino residents in LA County to help us better understand why these disparities exist. And I also asked the CEO to allocate appropriate funds to bring this report to fruition. Similar to reports on the state of Black LA County, which was commissioned back in 2020, and the state of Asian American, Native Hawaiian, Pacific Islanders in Los Angeles County, which was presented by Supervisor Horvath and I requested earlier this year. We must understand what is driving negative outcomes for the Latino community so that we can better serve all of our constituencies. The motion is not just about addressing the disparities, it's about ensuring that Latinos have the appropriate resources and opportunities to thrive in their communities with their families. Given the large number of Latinos in Los Angeles County, ensuring that they are successful also ensures that all our county residents can continue to grow and prosper. The motion before you all today is a step in the right direction, I believe, and to ensure that there's equity for Latinos in Los Angeles County. And I also at this time would like to read in the following revisions to the motion. Strike item 1 and replace it with the following. Direct the Chief Executive Office through the Anti-Racism, Diversity, and Inclusion RD initiative to consult with a representative group of Latino stakeholders and academic and or research institutions and create a State of Latinidad Los Angeles County report. The report should be presented to the board biannually and include a separate directive to read the following. Direct the Chief Executive Office through the Budget Operations and Management Branch as a part of fiscal year 2025-2026 recommended budget phase to identify $600,000 in one-time funding to produce the report consistent with the fiscal resiliency protocol. And I'd like to thank Artie and their staff and also the CEO for working with our staff on this. Thank you very much, Madam Chair. I'll turn it over to our co-author.
Thank you, Madam Chair, and thank you, Supervisor Solis, for putting forward this important motion and for welcoming me as co-author on it. Latinos account for more than half of the U.S. population growth in the last 2 decades. And almost 8 out of 10 of the new workers joining the workforce between now and 2030 will be Latino. Latinos make up half the county's population, including 43% of my district, the 3rd district. And I have seen firsthand the need for resources for these issues that have disproportionately impacted our Latino communities. From the rates of silicosis in the Northeast San Fernando Valley and pathways to micro-entrepreneurship through street vending, to the needs for translation services and bringing visibility and resources to our indigenous migrant communities. It is important that we know how the county is doing when it comes to services and resources for our neighbors. This motion not only directs the creation of a report, but also has our county departments providing analysis on many facets impacting Latino communities and our residents. This includes social safety net programs, voter registration, open spaces, multimodal transportation solutions, street signs and wayfinding, and public service announcements for our Spanish-speaking households. We must also understand the educational outcomes and economic opportunities that exist today to know what we can do for our Latino communities tomorrow and beyond. I look forward to the results of this work and to ensuring we're doing everything we can to best serve all our residents throughout the county. Thank you.
Thank you, Supervisor Horvath. Supervisor Mitchell?
Thank you very much, and thank you,
I
Supervisor
didn't see your name.
Solis, for bringing this forward. You opened by saying maybe we don't use the term ethnic groups. I think we do. What we no longer use the term minority groups, because as you shared, in terms of the sheer numbers, it's not about minority. But when I hear the term ethnic, I think it is an acknowledgement of a rich, deep appreciation for cultural heritage and background. And so I think minority is the term that we should eliminate from our conversations completely. It goes without saying that the important contributions of the Latino community to the cultural, economic, and social fabric of LA County can't be overstated. And yet, despite these contributions, these stark disparities exist. And I would argue that's based on systemic racism. And for me, it is important that I call that out and acknowledge that is what holds the Latino community back and many others. I look forward to the work that can be done, not only in identifying the why, but in bringing forward solutions, particularly solutions that we in LA County can undertake, resource solutions to break the systemic racism barriers that prevent communities, the Latino community, from excelling. Now, in particular, as we face an uncertain federal landscape, I think we have a responsibility, a deep obligation to ensure that our local policies protect and empower our Latino community and beyond. In the 2nd District, we see the real world impact of such policies every day. So by investing in early education, bilingual health care, and economic opportunities, we're not just addressing these disparities, but we're building a stronger, more resilient county. I also acknowledge that the Latino population is very diverse, and subgroups differ with respect to country of origin, genetic ancestry, immigration history, and geographic distribution. So studying this community as a whole sometimes masks critical disparities among subgroups. So I think it's important that as we embark on this work that we don't treat the community as a monolith, but we really actually dig deep to make sure that we are identifying true causes and therefore solutions that can be operationalized. I really appreciate your read-in, because ARTI isn't just a framework for addressing inequities. It's the engine that empowers our ability to identify and address disparities across every community. And so properly resourcing ARTI is critical to ensuring that the county has the tools to implement the comprehensive strategies outlined in the motion. I hope to have a study and a roadmap to improve outcomes for the Latino community. And so your read-in, I hope, will be the resources we need to get there. Thank you for the motion, and I look forward to supporting.
Thank you, Supervisor Mitchell. Now, Supervisor Hahn.
Thank you, Madam Chair. Supervisor Solis, thank you for bringing this motion forward, and to your co-author, Supervisor Horvath. I'm proud to represent the most Latino district in LA County, and since redistricting, the 4th district is now more than 59% Latino. And a lot of that is thanks to the addition of the 10 new cities and one unincorporated community that you previously represented, Supervisor Solis, that I was gifted in the redistricting process. You've known them, you represented them, you fought for them, you advocated for them, and I've really had the great fortune to getting to know them, to getting to understand their struggles and many of the things that they're going through that we're already trying to resolve. We just opened the first county park in Walnut Park, which was so much appreciated. Places like Southeast LA really work as a safety net. It's really the microcosm of what the county is. That's where the safety net can do the most good, where we can really make positive changes in people's lives. I've seen it firsthand. I remember visiting some of the homes with you that were still being cleaned up from years of Exide battery plant contamination, and having public hearings and meetings about that issue. I've heard the concern in the voices of the parents in these communities who, just like parents everywhere, want their kids to have the best shot at life, but struggle because of the challenges many times beyond their control. And this is just one of the many issues, from limited access to green space, as you talked about, to lower school outcomes, to affordable housing, to health care. These communities and other Latino majority communities like them across our county are filled with hardworking people trying to give their families the very best, but they continue to face serious disparities. And from our very beginnings, the story of Los Angeles County could not have been written without our Latinos. Today, though, many of them are facing unfair challenges, and we have a broad idea of what's missing and what solutions could work, but we owe it to them to dig deeper and deliver solutions, and that's what I think this motion will do to help that. So thank you.
Thank you, and I want to thank you, Supervisor Solis and Supervisor Horvath, for this motion. I find, when I look at the numbers as outlined in the motion, that the number of Latinos experiencing homelessness increased by 26%, but in 2024, despite an overall decrease in the number of people experiencing homelessness, the number of Latinos experiencing homelessness continue to increase, now making up 43%. There's no question that we need to look at what is driving these numbers, and commissioning a study will be very educational for all of us, and I'm sure will build on the research being done by the UCLA Latino Policy and Politics Center, as well as by many other renowned research institutions. I think it's important for us to see what opportunities this county can provide to break the barriers that exist, and in the end, it will not only benefit the Latino community, but the county as a whole. So with that, thank you for bringing this motion, as I look forward to learning more as we move forward. Would you go ahead, Supervisor Solis?
Yes, thank you for your comments, and I want to thank all of my colleagues because actually it's a motion that all of us obviously are very concerned about, and it isn't one that is lost on me. It's been something since I've been on the board, and I recall some studies that had been done even prior to my coming here outlining the disparities in LA County, a research project that some of our departments and the California Endowment were involved in. And at that time, even my sister who passed, Dr. Beatrice, was involved in some of that research. And I'm happy to say at least that we're attempting to go back to that and say, there's possibilities here before us to try to change that. But I've asked our directors to come and give us some feedback on what we can do better to help address those disparities and barriers or challenges that we face and opportunities. So I want to begin with you, Dr. Ferrer. I'd like to hear from you about what we can do better to address healthcare access, the issues, those that disproportionately impact that population, but it's not so different from that population, because we see it in the Black community, we see it with other communities that are impoverished. But at this time, I'd like you to be a little bit more specific and tell us what maybe some of those root causes are, especially as they relate to healthcare. I think those are things that we need to look at, and how can we better serve and address those disparities that they're currently experiencing in it, and it's intergenerational. So you may want to touch on that. Thank you, Dr. Ferrer.
Yeah, thank you so much, Supervisor Solis. I appreciate your leadership in addressing the specific issue around inequities that the Latino community is facing. And I also appreciate the board's focus. And I know I'm talking to a very both knowledgeable and skilled leadership around addressing root causes of inequities across different population groups. I think it is really important that we lift up what is happening in particular communities, though. I think that allows us to deepen our understanding, and certainly the experiences of Latinos is, while not homogenous, it is worth doing a deeper dive in. So thank you for the motion. I appreciate the call to do a study, and we're here to help. As everyone knows, we have a lot of data, and we have spent a long time putting together the data around different communities' needs and access to resources that are health affirming. So we have information both by every community, over 150 communities, that looks at the impact on people's health and the association to the resources that they have available to promote good health. And we also just completed the 2023 health survey, which really does a good sampling of individuals across the county to find out from them what they perceive as important health issues and what they experience as issues that affect their health and their health status. And it's informative, and it really allows us to, in fact, verify a lot of what we see in the outcome data. Latinos are, as you noted, more likely to be uninsured than any other population in LA County. They're also very likely not to have a routine source of care. And because they have lots of exposures in their neighborhoods, they also have higher rates of some diseases and deaths from those diseases, including diabetes and asthma. I want to just focus on the root cause issue by using sort of two examples. that were already mentioned by the board. The first is what happened with exposure to the COVID-19 virus. Blacks and Latinos in LA County, as everyone knows, had much higher rates of both mortality and morbidity. And while there was a quick jump to blame that on personal behaviors, including getting vaccinated, there's no data that supports that. As a matter of fact, if you're Black or Latino or you live in a low-income community, you're still more likely, even if you're vaccinated, to have worse rates of hospitalization and deaths associated with COVID than people who live in wealthier communities and are white and not vaccinated. So there's no quick solution by just saying, people have to behave in a way that allows them to be healthy. And if people did that, it would all be good. As a matter of fact, the lesson we learned from COVID is you've got to pay a lot of attention to exposures in the environment, exposures at work, exposures in the community, and where are the health affirming resources. If you want to provide free vaccines, as we all learned, and you rely only on your chain pharmacies and you don't have chain pharmacies in some of our communities, then that's a limitation on people's access to vaccines. If you want to really focus on overcrowding and poor ventilation, we have to look at our housing issues. And as you noted, Supervisor Solis, rent burden and lack of home ownership are very, very high in the Latino communities. And that has led to a lot of overcrowding and a lot of density. I also want to note that we're very clear that by looking at root causes, we understand the experiences of the Latino community that are related to other outcomes, economic outcomes, outcomes around opportunities, and I agree wholeheartedly with Supervisor Mitchell that you can't hide from the fact that the impact of racism and discrimination has on what resources are available to promote good health in our communities. At the Public Health Department, we love the fact that we get to work with all the other departments on bringing forward the resources that in fact promote good health, including what you said, addressing issues of lack of access to green space, lack of access to affordable and healthy foods, lack of access to good educational opportunities. The fact of the matter is that Latino students are less likely to graduate from high school than almost any other group of students in this county. And those are issues that require our attention across all of the departments, and they're also issues, as you noted, that will affect people's health status.
Are there any solutions? Can you just give us some of those,
Sure.
like a little menu?
Yeah, no, I mean, I think, you probably want to create, buckets under each of the health affirming resources that people need. And this board has done a magnificent job, frankly, on paying attention to that. So, if we start even with health, expanding people's access to health insurance is huge, but then making sure, as I know Supervisor Barger knows well, making sure that just because you have a card, if there aren't clinics in communities, and if there aren't people who understand your culture and speak your language in the clinics that are there, then we created a barrier to healthcare. So there's no easy solution, just get everybody insurance. We also have to make sure we have resources all across the county that people can easily access for the needs that they have. We're doing a pilot in 10 communities across the county where we have teams of folks. We're in partnership with a community-based organization, a community clinic, and the public health department. And we visit every resident in that neighborhood and we ask them, what do you need? Now, we are focused on health, but what people ask us for is what we provide services on. And the number one ask is around food insecurity. So that's not an issue that just belongs to a health department. We, because we're partnering with our wonderful community-based organizations, are able to immediately address that issue, and we work with Dr. Contreras and her team to really figure out, are people getting what they're entitled to, and if they're not, what are the barriers to them being able to get the services and the support. But if you're food insecure, then your health is going to suffer. So that's why the health department, public health department, feels like these are the paths forward. Work with our community partners, work with the other county departments, address the root cause issues successfully, which is what we're doing in that pilot. We're connecting people to what they need. Because we know if we connect them to what they need, if it's about housing, if it's about income, guaranteed income programs, we keep trying to enroll people who are vulnerable in those programs because we know it's going to make a difference and improve their health status. So I think we have some examples. I think other departments have examples of strategies that actually work because you're addressing root causes as well as making sure that you're reducing barriers to the services that we already have.
I want to continue on and ask similar question to you, Dr. Contreras, as well, because I know that there are many issues that Latino community members, young and old, face in accessing our Department of Social Services. And I know you have attempted to address that in the short time that you've been with us, but what are some of the factors that continue to plague our community?
Yeah, thank you so much, Supervisor Solis, for bringing this motion forward. And to Dr. Ferrer, I partly just want to say ditto to everything that she highlighted, but I will highlight a few things specifically related to our department. One is that we're taking a much closer look at our take-up rate. We're pleased with the fact that 48% of the people we serve are Latino, and that is comparable to the population as a whole. So in that sense, we're doing well. But when you look deeper at the disparities, you recognize that the need is higher. And so what does that actually look like? So for our CalWorks program, and this is data that we've been understanding better in partnership with the state, in our CalWorks program, the take-up rate is 37%. So that's a huge gap. In our CalFresh, it's nearly 80%. So that's a much less gap. And there's a story behind that, right? We've had very intentional efforts of outreach around CalFresh, and we've seen the benefits of that, and still there is a gap. And so we want to understand, go deeper. We can sort of hypothesize about why that gap exists, but we know that until we really understand from the communities that we're serving what is impacting either their eligibility or impacting their reaching out, or if there's access barriers. So those are things that we're doing. We want to be able to do as well Medi-Cal and GR and our other benefits. We want to have that understanding of who is likely eligible, and Artie has been a great support in kind of looking at that data. Who is actually eligible, who are we reaching, and where are the barriers, and then thinking about it geographically. And of course, this is relevant to, as has been highlighted, to other ethnic populations as well, and so we want to be able to look at that. I think the other thing connected to this is changing the narrative. And so there is still significant stigma around receiving public benefits. Even when we want to be positive about it and we want people to reach out, we follow it with things like, but we don't want you to become dependent. There's no data to support that people are becoming dependent on public services, yet that's the narrative that we hear time and time again. And I would argue, especially for our transition age youth, right, that are aging out at 18 or 19 or 21, the needs that they continue to have, being able to access these resources should be a given. Like it should happen. We should not shame them if they need the resources. Many of us who have children in their 20s or even 30s recognize, right, that need continues. And so we really want to work on changing that narrative. We'll see, just by way of example, people who are on Medi-Cal, we're required to ask them if they're interested in CalFresh. We will get hostile responses to those requests. People do not want to be on public benefits, even though the data would suggest that they would qualify. And so we have a lot of work to do in that space around.
Dr. Contreras, maybe the rephrasing of that, the use of language, instead of saying Cal works, immediately, it's the negativity is out there in the press and the media. Maybe testing that, because again, it goes back to culturally, linguistically appropriate. And I think just collaboration, just what you're saying, I mean, it's daunting.
No, absolutely.
Yeah.
And I want to highlight as well, because oftentimes when we hear things like food insecurity, we immediately go to, are they on benefits? Are they accessing benefits? What we have seen is very often they are accessing benefits. There is a significant gap between being eligible for our services and having a sustainable living wage. There's a significant gap there. And I do think that the more that we can understand that, the more that we as a county, not just DPSS, right? We all know it's across, we can begin to address those issues. So that would be the second issue that I would highlight. And then thirdly, and certainly something that your board has been incredibly supportive on, is our programs are far too complex. And as Supervisor Mitchell highlighted, you know, that the systemic racism that underlies the eligibility for our programs, the process, it's as if they're designed to keep people from accessing the benefit. And so they will fall off, or they're not eligible, or they'll just get frustrated. And so we want to understand that dynamic better and then continue to advocate at the state and federal level for changes in that complexity. We should not have different income requirements across programs that make it incredibly frustrating for those we're serving and also for our staff to be able to do that work. So, I mean, those are some of the things I would highlight as some of the persistent challenges we're facing.
Did our CEO did you want to make a comment?
Thank you, Supervisor. I would just say that we will work with Artie to help get the study done as requested. And one of the things that we talked about earlier when I first became aware of this motion is what it would take, you know, what does success look like? And so we know that this has to be well designed, well developed, it has to be resourced, and you have to have good implementation. And I was wondering if Dr. Contreras could talk to, I believe that the department is in the midst of revising the way that it conducts business on some of its programming, where you would have to require folks to come back into the office. And I thought that was related to maybe a recent labor issue. And so when we talk about what does success look like, we could have the best design and the best development of a plan. But if the department is considering, not by choice, but because of a potential recent IRCIME decision, I think that would complicate our efforts to have a successful implementation.
So we've made quite a bit of progress in expanding our access points. So whether it's by phone, by mail, in person, or on Benefits Cal, and we know that that's critical. And I want to use an example. I read in the paper recently that people were questioning, why does it take so long to count votes in California? And the response was something to the effect of, because we have so many different access points for people to vote, it's gonna take longer on the back end. And so we have access points. It makes it more convenient for our customers. That does mean sometimes that it means how are we allocating resources can be a challenge. And so those are things that we're heavily engaged into making sure that we would streamline. The suggestion that we go back to sort of a caseload managed system would create significant barriers for us and more importantly for our customers to be able to utilize that. So while it may be frustrating to wait on the phone, our wait times for last month I think were upwards of 45 minutes, far too long, not what we want to see. And while it may be frustrating to wait that long on the phone, to get in your car or on the bus or to walk to an office and to wait there would be much more challenging for people. And so we don't want to see that happen.
So what impact is IRCOM having on that, and how are you trying to change that? Because my understanding is that now we have to do that based on a decision.
So we don't have a final decision yet, but the suggestion is that it may move in that direction to basically an unwinding of the process that is currently in place. We have improved our relationship with the union. We have been working with them on a number of different issues. We recognize the impact that would have on our customers and on our workforce. We have a number of staff who telework. That could become a challenging issue if they're not providing services by phone. And so we're still negotiating, and I am hopeful that we can come to an understanding that's reasonable and really takes into account the impact on our customers and the impact on our staff themselves.
Thank you. I wanted to quickly turn to Lisa Garrett, our department head for HR. And you know, as we talk about diversity in the Latino community, it is so important to see that reflected in our workforce here at the county and our programs. So particularly in the management area,
And I'd like to ask you, what do our stats look like?
Our stats right now, thank you for this motion, I appreciate it, and thank you for this wonderful conversation, which will result in action. But for right now, the Latinos make up 43% of our workforce. They make up 31% of department heads, and over 20% of those in management ranks. And 34% Latino representation and management representation. So our numbers, when we compare our numbers to the greater Los Angeles area, our numbers are better. When you look at Los Angeles County across the state, I go to meetings with other HR directors for the other counties. Our numbers are great, and it starts at the top. It starts with our Board of Supervisors, and it goes down. When anyway, for Latinos, we are doing a number of things, and not just for Latinos, but for other diverse populations within our workforce. For example, to increase the numbers of leaders in leadership roles, we have created and stood up a LA County University. It's virtual, however, we have a variety of programs to support our employees who want to move forward. For example, maybe they want to go into supervisory roles. We have a supervisory training. For the mid-level managers, we have a management development program. And for those who are seeking the highest levels within the organization, like department heads and chief deputies, we have the executive leadership development programs, and Latinos are represented in all of these programs. We've also ensured that all of our employees are aware of promotional opportunities within the county. We've partnered with various community colleges, universities, community groups to expand our candidate pools to include diverse groups. We are right now building a competency database. So it's not about color, it's about the competency someone has. And we will build from that. You might be at one level of competency today, but we'll wrap around services and trainings to develop individuals in those competencies that are required for the highest levels of service in the county. We are building, and we're partnering with DHS on this, language access. So some of our exams will also be in Spanish to assist anyone who might not perform well on English-only exams. This is what I'm most proud of. We have championed JEDI, which is Justice, Equity, Diversity, and Inclusion, and we have partnered with ARDI on this, building out programs so people can see themselves and know that I belong here when they see the individuals who are participating in the programs. And these two ladies have been a part of those programs as panelists. We have also established a succession planning program, and all departments are required to have a succession plan. And so they are helping to build up the next level of leadership and our bench strength within the county departments. We are also ensuring that in unclassified recruitments, we present diverse candidate pools to our department heads, who are the appointing authorities, and even to our board when we're talking about department head recruitments. We also ensuring in our exam processes that there's no adverse impact in the eligible list that are being presented to the hiring managers from which they select. We've also reached out to the unions and how we can move employees from the clerical ranks to the administrative ranks. And so we're working on, hopefully, a strategy to make that happen. So in the County of Los Angeles, we're doing a variety of things, and our numbers for Latinos in higher level positions and other people of color have been increasing based upon the strong tactics that we have been using and putting in place, and all of the county departments are involved in this effort. It can't be just DHR, it's everyone's responsibility, and all of the departments are playing a part in that.
I just wanted to follow up with, you mentioned that the supervisorial percentages are a lot lower when you look at management and classified. What have you found out about that gap? I mean, what are we doing? Let me ask you also, do you have to be promoted or given a letter of recommendation of support from your immediate supervisor to be able to go up into that classification.
Thank goodness no longer is that a requirement, right? You stand on your own merits, right? And so some of that is through the exams, which could be an interview, it could be a written exam, it could be looking at what you have done in the past and how you are going to perform in the future. So what you're talking about is appraisals of promotability, and that is times past. We no longer just ask the managers who's next ready to go up, because that often perpetuates the disparities. And so, no, you don't have to get a letter of recommendation. It might help in some instances, but that is not the only indicator of if you are going to be promoted.
Right, and I do know that the board receives information, data on what statistics are available for our departments, but I would hope that obviously that we continue to have this dialogue with all of our departments. I
Absolutely.
mean, we've had this discussion, parks, lifeguard, firefighting, the fire department, everybody across the board. And especially in those highly technical areas, I think those are areas I think for the future that we want to look at. And you know, Artie can help us figure that out. But I don't have any further questions. I thank you all. I know you're working knee deep on a lot of these issues, and I really want to continue to support your efforts. So thank you.
Thank you, and Dr. Firth, thank you for pointing out that we know if there are disparities, because I know up in the Antelope Valley, it is oftentimes challenging to get access to health care. And so I appreciate you pointing that out, because I think it's important to, if you look up in the Antelope Valley, the one population that's grown the most is Latino population. And so there's no question that we need to be culturally aware, language barriers, but also access to health care. So I really appreciate you pointing that out. And then on the DPSS side, you piqued my interest. GR, how much is GR per month right now?
It has been $221 for decades.
Okay, and my understanding is that the number of applicants to GR is going up. Is that true?
It has consistently gone up over the last.
Do you have a breakdown or a profile of who's accessing GR?
We do.
Okay, the reason why I'm asking is because I know there was a time when GR was basically a temporary bridge for those, especially that were going to apply for SSI and be able to get a steady income based on their need. And so I'd be curious to know, of the people accessing GR, how many are transitioning over to SSI, which then I think, if I'm correct, Fezia, SSI, that we will then get reimbursed for all the GR provided to that individual during the period of time that their application's pending. Is that, or actually, Jackie, you might know that, I don't know.
Actually, I'm not.
I'm pretty sure, I know that the GR, or the federal government will cover, maybe it is from the point that you apply.
I believe it's SSDI, where you could recoup
Correct,
disability.
but that's what we do through the GR. And I just think it's important for us to recognize, number one, $221 is not a lot. And there was a time when it was higher than that, but that would cover like SRO, where we had SROs available, which we don't have anymore. So 221 is I would love to talk to people that are receiving it to find out how that is bridging the gap for them.
Yeah, and Supervisor, if I could just clarify, I don't know if we are able to recoup our GR payments when someone is approved for SSDI. It normally takes a long time, but I do know that the GR payments that we make, and Dr. Contreras can confirm, it's all NCC, and that number goes up every year. So every year the board is allocating funding on the GRs.
And unless federal government has changed, there was a time when we did get reimbursed. So I think we need to flush that out.
So just to emphasize, so our GR program is NCC,
Yep.
and it is probably the most robust GR program in the state of California. So as minimal as it has been a benefit that this county has provided. There's also, if you're deemed employment ready or employable, you're on the program for 9 months. And then by policy, you have to fall off for three months. So there are a number of challenges. So we're looking at a GR redesign. I'm going to get recommendations in the next couple of weeks on what changes can be made in terms of policy, in terms of grant amount. We recognize that that's a huge, would be a huge financial impact. I sit on a lot of bodies that are looking at homelessness and housing. I personally feel if we can help people up front, there's a lot of costs that we could avoid further downstream from a prevention standpoint. And so I do think that when we think about Measure A, we think about new opportunities, that we need to think in terms of how GR could be redesigned in a way that could help people up front. If I could just add one more point, because it is unfortunate, but the way that it is designed, if they're getting a housing supplement, $100 of that $221 grant has to go toward housing.
See, and that was, I'm glad you bring that up, and thank you, because I know that there have been unintended consequences of actions taken that then move people from being eligible for CalFresh. So I think it's important for us, even when we talked about increasing minimum wage, or when we were looking at IHSS employees and increasing their hourly rate, one of the unintended consequences was they moved from being eligible for certain programs that actually were necessary for them to be able to make ends meet. So I'm glad you brought that up. But
and Madam Chair, if I could just add, because you referenced the shift to SSI, so we work very closely to make sure that anybody who's eligible for SSI is able to shift over and to recoup whatever we can. We're also partnering with military and vets, because we have individuals that could be eligible for veteran services. They may not be wanting to talk about that right now, and so we're trying to make sure that we're identifying folks that could be, and the reverse as well. People that go to military vets, that aren't eligible, coming to us to make sure they get the resources they need.
So what am I asking, knowing that you are looking at revamping general relief, and all, I would ask that you maybe in a month come back to the board and report to us what you're looking at, so that we can take a look and weigh in on that moving forward. Because again, I look at the 221, that's not a lot, but then when you hear that 100's being taken, or 121 is actually what is the funds that they can use for day-to-day living, the cost of living's gone up, and I can guarantee you that that will be gone pretty quick. So I think it's important for us to see how we can leverage it, especially with Measure A. And then with that, they're paired with GAIN, correct? So for those that have the 9-month period that are employable,
The GROW, it's actually called START now.
Yeah,
the
okay.
START program. Yeah.
I just aged myself. Yeah, okay. But I mean, they
GAIN is
are.
how it works.
They are.
Yes,
Okay.
yes.
And then, last question: do you still have someone embedded at our with the jails that can start applying for SSI for those individuals that are in jail that are coming out?
So we are re-looking at that relationship. During COVID, those individuals were pulled out, but we've been working with a number of other partners in the county to figure out what's the best mechanism to make sure that they get on.
Okay, yeah, I'd like to get a report back on that, because I know that was something that actually came as a result of someone being released that had no income, that got hit by a train. And we found that in fact, they could have applied in jail when you've got all the documentation on SSI. When they get out, they would actually have a stream of revenue to help house them. So I think it'd be important for us to see, and Supervisor Solis is right, JCOG would be a perfect vehicle to actually maybe plant this program, recognizing that sometimes the barrier to get on your feet is the financial once you get out. And we want to provide all the resources possible.
I think DPSS should also follow up with DHS and inquire about the new benefits under the CalAIM waiver.
Yeah, I mean, these are examples when I made my comments where that we break down the silos, because I know that and I know, Jackie, you talk to them, but it would help this board to really connect all the dots and see where policy-wise we can help facilitate the move to whatever you deem appropriate with GR, to maximize the benefits and ensure that we are addressing those that are in the greatest need, 'cause that's really what GR is for.
I welcome that opportunity.
Thank you. Now Supervisor Mitchell.
Thank you. Thank you very much for the question, Madam Chair. I look forward to hearing about the concepts around general relief. I was saddened to hear about the very modest take-up rate on the entitlement programs, particularly as we're entering this season where we know people are going to be afraid, particularly our immigrant community, and the whole concept of public charge. So if our take-up rate is already low on documented residents, it's only gonna, get worse. And so I'm not sure it's a cart before the horse, Supervisor Solis, if we change our language or if we just try to do a better job of changing the concept of government is here for you. And I'm not. That's a long-term struggle that we seem to be losing.
Nomination for Chair Pro Tem. I want to thank Supervisor Hilda Solis and Supervisor Horvath for this motion on the state of the Latino in Los Angeles County. Latinos make up nearly 50% of the Los Angeles County, and their contributions are countless. Latino culture enriches every aspect of the county, from music, dance, food, art. Furthermore, Latinos are a key driver of the LA County economic growth and an important sources of economic strength and resilience. Latinos are the motor that moves LA County. The county must continue to work on developing a more strategic and comprehensive plan to address the challenges Latino residents face day-to-day basis. I urge you all to support this motion. Thank you. Greatly appreciate you. Next speaker, please.
Val Hernandez, your line is open. You may begin.
Thank you so much. Yes, my name is Val Hernandez Castillo. I am a businesswoman and an advocate for my community. I am the founder and CEO of Latin Aid and Latina Fest. And first of all, I want to thank the supervisors for entertaining this motion, and in particular, Supervisor Hilda Solis and Supervisor Horvath for championing it. My company and organization's missions have always been about representation. With Latin Aid, I have worked for more representation of Latinos in the arts, film, and television since 1980. And with our community organization, it's about empowering Latinas, and in particular, promoting and providing resources to Latina entrepreneurs. But all that told, with both of these, has been about representation. Because Latinos contribute so much to the county of Los Angeles, culturally, economically, and so many other ways. We make up almost 50% of the LA County, and we are essential. Time has expired. Next speaker, please.
Next is Jeanette Ellis Royerson. Your line is open. You may begin.
Good morning. My name is Jeanette Ellis Royston, president of the NAACP Pomona Valley branch, serving 5 cities in Los Angeles County: Diamond Bar, Laverne, San Dimas, Claremont, and of course Pomona. I want to thank Supervisor Hilda Solis and Lindsay Horvath for motion number 3. I strongly support Latinos' rich history and incredible contribution to Los Angeles County and beyond. Therefore, recognizing their importance and their disparity, please vote yes on item 3. Latinos are entitled to civil rights and to human rights. Thank you so much. Thank you for this, item 3. Surely appreciate it, and I strongly support it. Thank you.
Thank you. Next speaker, please.
Next is Elvia Torres. Your line is open. You may begin.
Good morning. My name is Elvia Torres, the CEO for Spirit Family Services, a community-based organization serving families in Supervisor District 1, 4, and 5. Our mission is to empower families, improve health and well-being, and strengthen the community. We serve over 6,000 families annually, 80% identifying as Latino, and close to 40% receiving services in Spanish. I would like to acknowledge that our county is facing the shortage of mental health clinicians, especially those who are speaking Spanish and bicultural. This is an important area of focus for us all, as addressing this gap is crucial to meeting the diverse needs of our community. I want to thank Supervisor Solis and Supervisor Horvath for the motion on the state of the Latinos in Los Angeles County. Latinos are a diverse community with a wide range of needs that vary across generations. Despite their significant contributions, Latinos continue to face disparities in education, health, economic well-being, housing, living.
Next speaker, please.
Next is Jeanette Villa. Your line is open. You may begin.
Hi, good morning. My name is Jeanette Villa. I am with the Los Angeles County Chicano Employees Association, also known as LASEA. We provide legal support and resources to county employees, ensuring their careers and careers that are protected while empowering them through advocacy and community engagement. I want to express my gratitude to Supervisor Hilda Solis and Supervisor Horvath for their motion on the state of Latino in Los Angeles County. Latinos make up 50% of Los Angeles County population, have made invaluable contributions to our community. Their rich culture enhances every facet of the county life, from the arts and cuisine. Moreover, Latinos are a crucial force driving LA County's economic growth and resilience. Despite the significant contributions, Latinos in our community continue to face notable disparities in key areas. Education, Latinos.
We will now go to in-person speakers. Please, you're muted.
Hi, Fernando Guerra, professor of Chicano, Latino Studies at Loyola Marymount University for over 40 years. Even though I'm in my 60s, I consider myself a child of LA County, having been born at General Hospital, now LA County USD. It's a great opportunity for the county to assess the status of Latinos. In absolute numbers, Latinos have made great strides in every aspect of life in LA County. However, there continue to be disparities. What are the causes, the current status, and more importantly, policies that can be pursued to mitigate the disparities is a great opportunity to study. Demographically,
Latinos are the largest group and will continue to grow, but at a much lower rate and for different reasons. Much lower because LA County is growing slower, much different because it's no longer immigration that is a driver. LA County voters want you to invest. $18 billion of bonds were passed in LA County alone, Measure A, you know all that. So I love the work that you do.
Next speaker, please.
Thank you very much, Dr. Guerra, for coming.
Good morning, my name is Cesar Montoya. I'm here on behalf of the UCLA Latino Policy and Politics Institute. At UCLA LPPR, 70 faculty experts and 21 staff members really focus on research that sheds light on policy issues that matter most to the Latino community and other communities of color. Thank you, Supervisor Solis and Supervisor Horvath, for your dedication and leadership in drafting this motion. We know that Latinos make up nearly 50% of the county's population, and we are a key driver of the economic growth of LA. But despite the contributions of our community, systemic barriers continue to persist, creating disparities in education, health, economic well-being, housing, and access to green spaces. Latino students experience lower high school graduation rates and college enrollment rates. Latinos have less access to green spaces, and Latinos have faced chronic health inequities that became more apparent during the pandemic. Today, on behalf of the UCLA LPPI, we ask for your support in approving this motion, and we ask for your continued partnership to address these critical challenges.
Next speaker,
Very
please.
much for coming.
Good morning, Board of Supervisors, Chair Barger, Byron Jose with the Trans-Latino Coalition. As a Stretches Messenger, the Trans-Latino Coalition has worked with ARTI on various reports, as well as CFCI's community engagement processes and report backs. And most recently, as part of the Latinx Experiencing Hopelessness Task Force and upcoming reports. We asked Supervisor Solis and or the chair to ensure to amend this motion to ensure that there's a directive to not only uplift but include the voices of trans, gender expansive, and intersex Latinas in Los Angeles. We also want to make sure that there's a gender responsive lens, given the over impact and over representation of Latinas in our county carceral system. Well, I would like to thank Supervisor Mitchell for the clarification on the rich and diverse ethnic makeup of LA County's Latinidad, therefore specifically ensuring that there's the voices of comunidades originarias and indigenous communities that don't get erased as part of Latinx. Thank you. Have a good day.
Can I ask you a quick question? Thank you.
Okay.
Because I would ask Dr. Freer, but they stepped away. Do you know if either the state CHIS survey or the health survey that Dr. Freer mentioned, that they just completed in the Public Health Department 2023, includes any questions around transgender?
I would have to check with
Okay,
Dr.
I'll check with Dr. Freer. Okay, thank you.
Thank you, Supervisor.
Yeah, and I would just add, I don't think that our report or our motion excludes anyone. So that's not our intent. And I believe that, you know, all of us are listening, our CEO as well as Artie. So we appreciate that. Okay? Thank you. Okay, next speaker.
Good morning. My name is Richard Zaldivar. I am the Executive Director of the Wall Las Memorias here in Los Angeles. First of all, I want to thank you, Madam Chair Pro Temp Solis and Supervisor Horvath for this motion. This is extremely important. I even brought a few of my program managers here because it's great concern to them. Latinos make up 50% of LA County and their contributions are countless. Despite the enormous contributions, Latinos in Los Angeles County continue to face significant disparities in several key areas, including education, health, and economic well-being, housing, literacy, to name a few. This is important to us because, especially with a new administration taking power in Washington, this is groundbreaking, and especially for the Latino, Hispanic, LGBTQ community, which continues to be undercounted and underserved. And so I ask and I appreciate all of you to support this incredible motion. Again, the 5 female board members lead the nation in innovation and create.
Thank you and congratulations to your anniversary, Las Memorias. Thank you. Next speaker.
Anything you can do, I can do better. I can do anything better than you. Yes, I can.
All right. You guys calm down over there. Thank you for giving me your time today. I would like to thank many who have allowed me to use their voice today. First, Brown Pride has indicated that they want their land back, the Chavez Ravine. Brown Pride had also stated that we use BLM abbreviations first, the Bureau of Land Management. And BLM has been given a very negative and needs to come back to Bureau of Land Management and the positive, proactive programming they do in recreation. In God We Trust Americans, they have also indicated that they use pride, boys, proud boys first, and inclusive and our peaceful.
Thank you. We will now go back to remote speakers. Moderator, we have the next speaker, please.
Monica Mejia, your line is open. You may begin.
Many times Latinos are unaware of the opportunities to apply for affordable housing. Many Latinos are homeless and they are unaware that there are resources for homeless folks. Sometimes it's a language barrier, a culture barrier. I'm very grateful that we're able to focus on the needs of Latinos. Thank you so much.
Next speaker, please.
Eric Preven, your line is open. You may begin.
Hello? Can you actually hear me?
Yes, we can.
Is that a yes? Okay, thank you. Can you just refresh my memory? Is this the same item? It's been on for quite a while? Or did we change? That's my only question.
Item 3.
Yeah. Okay, well, thank you, Supervisor Solis. I mean, what an enormous, situation we have. And it's such an important part of Los Angeles, and I think your efforts to drag Pereira up and see what we're doing and have everyone rolling up their sleeves is very, very appropriate. Now, I wasn't able to get at the detail of how we're going to get all these resources going and all this frenzy. I mean, it does sound, I have to admit, having been observing board for a long time, like it's going to be, steering a giant.
Next speaker, please.
thank you. This board is a disgrace to all Latinos. Latinos have had affirmative action for 60 years. What have the Latinos done to care for these issues for their fellow Latinos over 60 years? Mitchell's systemic racism excuse is disingenuous. Latinos are as racist as any ethnic group. Latinos need to learn English. As Barger, the lack of health care is on you and the county. You can't deal with the syphilis epidemic, let alone anything else. Stop spending money on illegals. Your obsequious public health doctor is an embarrassment to academia and healthcare. The Asians are the ultimate minority group, which goes to Dr. Ben Stein's observation. It's culture, stupid. Thank you.